At AARP Missouri, we want to support you as you age. But first, you should learn a little more about us. AARP is a nonprofit organization working to help adults 50 plus in Missouri live their lives to the fullest. We advocate for over 700,000 members on important issues such as strengthening Social Security, protecting access to health care, and ensuring everyone has independence and choice as they age. AARP Missouri also offers online tools, resources, and programs you can access right from the comfort of your home. Learn how to protect yourself from fraud and scams with the AARP Fraud Watch Network. Become an active part of AARP Missouri as a virtual volunteer. Find support while caring for a loved one through our caregiving resources. And enjoy a variety of fun virtual events that improve your health and wellness, like our exercise series, Moving It. At AARP Missouri, there's an entire community waiting for you. Learn more about us at aarp.org/mo.
Hello, everybody, and thank you for joining AARP Missouri for our February Caregiver Talk. This month's topic is the stress connection, heart, health, and stress. And if you're a caregiver, you may be more acquainted with this stress part of this topic than you'd like to be. I'm Diane Hall, Community Outreach Director for AARP Missouri, and I'm happy to be able to share this live presentation with you. As part of AARP's mission, we work to enhance the lives of all people age 50 plus and their families. We have resources and information online at aarp.org/mo and information about AARP activities and events wherever you may be at aarp.org/near-you. AARP Missouri's efforts to help people live their best lives include many things. Virtual options like this one's that are good for caregivers or anyone who faces challenges attending in-person events. We also have resources for protecting yourself against fraud through online information or local shred events. And we're working on livable communities, which goes way beyond housing and transportation to include things like our Moving It Fitness series online classes, in-person walk with a doc, and today's webinar for caregivers. We hope you'll take advantage of AARP's resources and information. Go to aarp.org/local to find out more about what we have to offer. Now, I'd like to introduce Rachel Hiles, founder of Sandwiched KC. Rachel, thanks for joining us.
I'm glad to be here. Thank you for having me. Today, we are talking about heart health in honor of National Heart Month. Anybody who's cared for a loved one or has in the past or is currently caring can probably tell you that caregiver stress is unavoidable. And it has such a negative impact on our bodies, minds, and souls. So today we wanted to talk a little bit more about how we can care about our hearts and mitigate our stress. And today our local expert on our Caregiver Talk is Dr. Rachel Sosland with HCA Midwest Health. I'm going to turn it over to you. Would you tell us a little bit more about us, about yourself, and just get right into it?
Sure. Hi, Rachel. Thank you both, Diane and Rachel, for having me today. I appreciate the opportunity to talk to you guys. And I'm a cardiologist with Midwest Heart and Vascular, working in the metropolitan Kansas City area, working at our hospitals, Overland Park Regional, Menorah Medical Center, and some hospitals in Missouri as well. We work at Centerpoint Hospital and Belton Regional as well. I'm happy to be here today to talk to you guys about heart health and a little bit more about how to take care of our own hearts and protect our hearts for the future and when we're caring for other people. So thank you again for having me. And I guess my sharing may not be working, it says.
Try it again. It should be going. Give it a whirl.
Can you guys see this okay? All right,
Yes.
excellent. So heart disease is always the question is how do we determine really who's at risk for heart disease? And this is a kind of a big question and a concern that a lot of us have is how do we identify who really should be evaluated? So I'm just going to talk a little bit about what makes people at risk. And as many of you know, heart disease and blood vessel diseases are actually the leading cause of death in the entire United States. And actually about 2,400 deaths occur every day from heart disease. And so a healthy lifestyle plays a significant role in how to reduce our risk of heart disease. So I want to just talk a little bit about that. I think what we don't always understand is heart disease can actually permanently damage your heart and your life. And so if we don't treat it, serious complications can result from that. So some things we can do is kind of understand, first of all, like what we're dealing with, what is heart disease. And it can include blockage of blood vessels, which is the most common cause of heart disease, but it also includes rhythm issues such as arrhythmias or atrial fibrillation. It includes infections on your heart, or even people can be born with abnormal heart conditions. So there are risk factors that we can control, and this is really important to kind of talk about because there's a lot of things we can do to help prevent heart disease. So smoking, if you smoke, we need to quit smoking. If you have high blood pressure, high cholesterol, being overweight, physical inactivity, diabetic or metabolic syndrome are all risk factors for developing heart disease. But there's a lot of things that we can't control. And some of that is our family history, such as if a woman in your family, like a grandparent or a sibling or a mom, developed heart disease at 55 or younger, that's very significant. Also, there are certain risk factors that we develop during pregnancies for women that can also put us at higher risk. And even a male or female gender may have a higher risk factor. So some other risk factors that we don't always think about is pregnancy-related risk factors, such as preeclampsia or eclampsia happening during our pregnancy can actually cause a high risk of developing heart disease earlier in life. Also gestational diabetes or having a stillbirth or miscarriages. Also, people undergoing cancer treatments often don't realize they're also have increased risk of developing heart disease. And then I'm mentioning depression and stress, and we're going to talk a lot more about the stress portion of that. But trauma and abuse. And I think when you think about your own risk and you kind of think about which risk factors apply to you, you can kind of gauge better if you're at risk of heart disease. And then some other risk factors, again, are sleep apnea, the stress. If you drink too much alcohol can be a risk. Sometimes taking birth control can be a risk. Being anemic, eating unhealthy, or having low vitamin D levels. So with heart disease, as I mentioned, there's many different kinds. The one that's the most common that you guys have probably heard of the most is what's called coronary artery disease. And that happens over years. So it doesn't always happen all at once. So there's a lot of room in the middle that we can help and modify the risk. And what happens is over time, the heart arteries don't get enough blood supply, and that way, and then you get blockage and you can have a heart attack. So what happens is over time, you get plaque buildup in the arteries, and that limits the flow of blood through the arteries, which then leads to a heart attack. And so once that artery becomes blocked, people start getting chest pain, and you can get lack of blood flow to your heart, which then causes a heart attack. But the good thing is that we can prevent so much of this if we know what to do. So prevention includes lifestyle changes and sometimes medications. And so I'm just going to talk about that. I really want to talk about stress, and that's a big thing we want to deal with today, and how stress really affects the heart and causes what I was just talking about. So unfortunately, stress can actually lead to clogging of the blood vessels that nourish the heart, and that results in the coronary disease that I was showing you. Stress also increases your cardiac activity, and therefore it can lead to high blood pressure, which is one of the risk factors. And also cortisol then increases your blood sugar levels when you're under stress. And so then it helps to boost your energy, but then you can become diabetic. Being diabetic then causes heart disease. And unfortunately, chronic stress leads to an increase in levels of cholesterol levels. So that over time, the stress increases inflammation and your cholesterol goes. So what happens with stress is your blood becomes stickier and thicker. And so you have a higher chance of your arteries becoming blocked. Stress also causes our energy to be mobilized away from fighting infections and fighting diseases. and therefore we become more vulnerable to these infections. And as I was saying, stress increases inflammation all throughout your body, but also your heart. So some of the risk factors for stress that we all have, but to kind of think about if we're at higher risk, would be some childhood experiences, certain personality traits. There are genetic traits as well. There can be immunologic diseases like rheumatoid arthritis or lupus that can also increase stress in our bodies that can lead to heart disease. As we become older, we often have more stress as well, or don't handle it as well sometimes. And so we become at higher risk for heart disease. And I highlighted caregivers here because I know that we are all caregivers in various forms, as either as a mother, as a sibling, as taking care of our parents. And so caregivers are certainly a risk factor for stress. Being divorced or widowed is also a known risk factor, and then occupational stress. So the question is, what does a stressed heart feel like? So what it comes down to is you can have a stressed heart and have very significant symptoms. You can get chest pain, you can feel your heart racing, you can feel palpitations or fluttering, you can feel shortness of breath or sweating. And severe stress actually has been shown it causes a basically like a heart attack syndrome, and your heart function can drop from severe stress. So maybe a loss of a loved one, or a divorce, or a shocking news that you found out can actually really affect the heart in different ways. So I just want to kind of go into the symptoms of a heart attack, because a lot of times we get fooled, and it's important to not miss the symptoms if you have any so that you can get help quickly. So the most important thing is to know your body, because a lot of times you're going to get a warning sign. You need to trust your instincts. So a lot of times you think about, well, I'm going to have chest pain. It's going to be classic. It's going to be happening either at rest or when I'm walking. The pain's going to go down my arm or into my neck. But it doesn't always feel like that. And women also tend to have very different symptoms sometimes. You can have pain in your back or your jaw, but you can also just feel nauseated or feel like you've got the flu, or be very tired, or sometimes just a feeling of anxiety or loss of appetite can indicate that you actually have heart disease. And some of this can even occur with physical or emotional stress. So it's not always classic. And so I want people to kind of be thinking about, if you have any of these symptoms, to talk to your healthcare provider. Because what's really important is surviving this heart attack. If you ever think you might be having a heart attack or any symptoms that I was talking about, you should always call 911 immediately. Because if you can learn the warning signs, the fast action and getting to the hospital quickly is what will save your life. The emergency medical team will treat you right away. And something I always want to mention is, don't drive yourself to the hospital if you think you're having a heart attack. Make sure you are calling the ambulance. And the other thing to mention is, I know sometimes it's confusing, right? If you're having symptoms, we don't always know if it's a heart attack. But remember, we don't know either until we check you out. And so don't ever be embarrassed if you don't actually have a heart attack, but you were having symptoms. It's very important to get in and get checked. So it's good to talk to your doctor and know about your risk for heart disease. Talk about these risk factors. Make a list of questions before you go into your doctor so you can have a really focused visit, and it can be really useful. And then I would take notes on what your healthcare provider says, because sometimes when you leave the office, you kind of forget what they tell you. And then also it's important to talk to your healthcare provider about some changes that you can make, either like increase your activity or be more healthy, things that might help. So the question comes down to, like, who should be screened? How do we know if we're at risk, right? So everybody really should know their numbers. And people that may have like borderline high blood pressure or borderline diabetes, all the more reason they should be. So these are some numbers I wanted you guys just to see, so you can compare. If you happen to know your blood pressure, you want it to be under 120/80. You should always have your cholesterol checked at least once a year. And you want your LDL, which is your bad cholesterol, to be under 100. Your HDL is your good cholesterol, to be over 50. Your triglycerides to be under 150. And this is your body mass index, ideally under 25. And then your waist circumference for a female should be less than 35 inches, and for a male less than 40. And then for diabetes, the current guidelines actually say an A1C less than 5.7, and you're considered around pre-diabetic if you're anywhere around 5.7 to 6.5. So if you should have your numbers checked and compare your numbers to the current guidelines and see if you are taking care of all of your risks. So some screening tools that are really easy to help assess your risk would be a coronary calcium score. There's also testing with your cholesterol, and then a more specific advanced cholesterol testing with the lipoprotein A, which are genetic risk factor for heart disease. There's some measures of inflammation, and a carotid artery thickness can be measured. I put down here the newest blood pressure guidelines because a lot of times they've gotten even tighter recently. And it's really important that a normal blood pressure is less than 120/80. But even if your blood pressure is under 140, you're considered to have high blood pressure. So that might be an opportunity to be on medication or change some lifestyles so that your blood pressure improves. Ways to control your blood pressure: stop smoking if you smoke. You want to increase your physical activity. Want to choose foods that are low in salt because that can raise your blood pressure. Limit alcohol to at least less than 1 drink a day. Try to lose some weight. That will actually lower blood pressure. If you can lose about 5 to 10 pounds, you can lower your blood pressure even up to 5 to 10 points. And then if your doctor advises you to take medication, then make sure you're compliant with that medication. So some of the benefits of lowering blood pressure is actually you can reduce the risk of a cardiac event, like a heart attack, by up to 22%. So that's pretty significant. And the larger blood pressure reduction you can get, if you can get your blood pressure down even lower, then your risk of heart disease even goes down more significantly. So like I was saying, if you can lose 10 pounds, you can actually drop your blood pressure by 10 points. So it's not always with medicines. A lot of things we can do on our own. And I just want to mention smoking. Hopefully none of you smoke, but actually 1 in 5 smoking-related deaths actually are from heart disease. And in patients that are under 50 years old, smoking increases your risk significantly. And then for women that take like birth control pills and smoke, they have a very high risk of blood clots. I want to talk about cholesterol for just a second too, because this is another major risk factor for heart disease. And so these are the current guidelines. The total cholesterol you want to be under 200. Like I was talking about earlier, for your HDL, your good cholesterol, for a male over 40, for a female over 50. And your LDL, which is your bad cholesterol, to be under 100. There's a lot of things we can do to actually lower our risk of heart disease and lower cholesterol. So just to talk about some diet changes, which is important for all people, including caregivers, because we're often making meals for other people, and we want our families to be healthy, or the people that we're around to also be healthy. So you want to eat food that's low in saturated fats and trans fats. You want to make sure you're eating a low salt diet. Limit alcohol to no more than 1 for a woman and 2 for men. And then eating whole grains, fruits, vegetables, chicken, fish, not a lot of red meat, and then non-fat or low-fat cheeses and milk. So a lot of things we can do by lowering our risk for heart disease can be happening today. We don't have to say, oh, I'll start in 5 years, because the things we do now make a significant difference. And it doesn't mean that just because you didn't start 5 years ago, starting now won't make a difference. It actually will make a significant difference. So if you can start now, if you smoke, please quit smoking. That's the #1 thing you can quit. And then being physically active is really important. So during the course of a week, you should try to exercise about 30 minutes, 5 days a week. So a total of about 2 hours and 30 minutes. These are American Heart Association recommendations to help lower your risk of heart disease. And then add strength training about 2 to 3 times a week. And then if you're diabetic, make sure that your diabetes is managed. Make sure your blood pressure is controlled. Treat high cholesterol either through diet changes and lifestyle or with medications. And then I want to talk about how to deal with stress, because as I talked about earlier, stress is really a significant risk for developing heart disease. So there's some behavioral things you can do, like meditation or exercise or socialization. I know that's a big thing. Some people feel very isolated, especially in the last few years. And so more socialization actually helps reduce stress as well. And then there's some cognitive things like problem solving and planning that can help reduce stress. And exercise also significantly reduces stress and is helpful for heart disease. So people should know that you don't have to exercise all at once. To try to get that 30 minutes in, you can do 5 minutes multiple times a day. You can do 10 minutes at a time. It doesn't have to be strenuous, but we know that some strenuous exercise can tend to be better than non-strenuous. But just if you can get in the 30 minutes most days of the week. And there's also a lot of community resources that are available that if you're thinking, oh, I don't have a blood pressure cuff, I can't check my blood pressure. A lot of local pharmacies have blood pressure cuffs that you can go in and check. The local library has blood pressure cuffs. American Heart Association and a lot of different organizations offer CPR training. And this is really important for people to know CPR. So if somebody had an issue that was with you at any type of location, that you could jump in and would know what to do and feel safe and secure to helping that person. Whenever you're in an environment like at a Chiefs game or a Royals game or at the library or a museum, always kind of look where the nearest AED is. That's the defibrillators that are often on the wall. Because if there was a situation, you want to know how to respond quickly. And then it's always important to use family and friends for support and to help relieve stress. And I put this picture in because it's up to you to protect your heart health. It's never too late, and start today. And these are my kids and my family. And the reason that I feel like heart disease is so important to try to prevent is because we're preventing it for the people we care for, right? For our loved ones, for our families, for the people that depend on us. And we cannot be a good caregiver unless we're taking good care of ourselves. That's really important. So thank you again for asking me today to talk to you guys.
That's everything you said is so true, Dr. Sosland, and we'd love to thank you for joining us today. I think Diane could agree that you shared a lot of great information, stuff that like I didn't even think about, honestly.
Thank you.
And I love the resources that you mentioned. In fact, to close it out, we wanted to just mention some specific resources. Specifically, when you mentioned the blood pressure cuffs. I didn't know that with the American Heart Association has a partnership with the libraries. And it's the Kansas City Libraries with Heart. We'll make sure that we drop all these links in the video description below. But all the there are many libraries across the Kansas City area and other organizations that have blood pressure cuffs for you to check out. The American Heart Association also has a caregiver support page with lots of great information and links on there. And they have even more help that you can find to see more information about financial, mental, and emotional resources at supportnetwork.heart.org. And I know Diane probably has some great information to share as well, but I know that AARP Missouri has been hosting yoga for caregivers, which falls right in line with what Dr. Sosland was saying. And I know when I was taking care of my grandma, I did not do a very good job of taking care of myself, but after she passed away, I started doing yoga almost every day, and it made a huge difference for my health physically and mentally. So I highly recommend that you check that out. And if you're feeling isolated, like Dr. Sosland said, you could always connect with Sandwich. We have 2 virtual support groups a week, and we do other stuff online, so you don't even have to leave your house. Diane, do you have any other resources to add that people might want to know about as they care for their heart health and a loved one?
You know I do, Rachel. I always have more AARP resources. AARP has a vast supply of caregiver resources at our Caregiver Resource Center. I'll highlight one of them, which is the AARP Caregiver Resource Guide. It's at aarp.org/caregiving/care-guides. But you can also just go to the Caregiver Resource Center, and that's aarp.org/caregiving. And I've forgotten the count, but there's something like 80 different resources by area of resource at the bottom of that page, and you can click on as many as you like. One that I would also like to highlight is there's an AARP family caregiver discussion group on Facebook that's a great resource, particularly if you're socially isolated. They're really non-judgy. Whatever you're going through, whatever stress that you're having, Somebody else has already gone through it, and if they can't help you with it, they can at least empathize. And you can go on Facebook and just search AARP Family Caregivers, and it will pop up for you. It's a really great resource.
And we'll drop the link in the video description for that one as well. Again, Dr. Sosland, I really appreciate, we both appreciate you taking time out of your very busy day to help us educate family caregivers in the area about heart health and taking care of their hearts. So, I'll turn it over to you, Diane, to close it out.
All right. Yes. Thank you, Dr. Sosland, for joining us to help us learn about how caregivers can better manage stress to protect their heart. The thing that you hit in different ways, different times about exercise seems like that helps everything. It helps stress. It helps your heart. It helps your brain. So we hope that people will take this to heart. I was screen grabbing a couple of things. I'm like, oh, I need to get those checked. So we really appreciate it. And to everybody who joined us, we hope that you've enjoyed today's webinar. Next month, we'll be hearing about a proactive, all-inclusive model of care for older adults that might be helpful for caregivers in the Kansas City area. So we hope you can join us. Keep an eye on aarp.org/local for other upcoming topics. In the meantime, please visit sandwichedkc.com and aarp.org/Kansas City for more information you can use right now. We hope that we'll see you next month. And in the meantime, please be as good to yourself as you are to others. Thank you for spending part of your day with us, everyone. Goodbye.
Bye-bye.